Alam mo yan. Ay naku, ako sa'yo. Mag-tiktok ka muna. Turuan ka yan. Alam mo yung para-para G? Turo ko sa'yo para-para G. Oo, para-para G. Turuan kita. Mag-zumba na lang ako.
Magandang araw para doon sa ating katanungan kung bawal bang mag-exercise ang taong may asthma o hindi. Depende po yun sa sitwasyon. Actually, sa mga asthmatic patients namin, we still encourage exercise. Yun nga lang po, kung ikaw ay known asthmatic, at lalo na kung ang trigger factor mo ay exercise, you have to have your medication at least 15 to 30 minutes before the activity. Ibig sabihin, pwede po kayo mag-nebulize or magkaroon ng inhaler o yung puff ninyo. Usually yan 2 doses, 2 to 4 doses before the exercise. Ang aim po ng mga medications na binibigay namin sa inyo o yung maintenance medication is to prevent you from having asthma exacerbations. And in fact, in one of the management of asthma, we encourage exercise because this will enhance also the immunity of the person. So it will never be an indication for us to halt exercise because this will help the patient. However, you always have to know if you have shortness of breath during the exercise, you really have to stop, okay? And make sure to continue your maintenance medications. Ano nga ba ang asthma? Asthma is a lung condition wherein there will be narrowing of airways o yung daanan ng hangin natin ay lumiliit, kumikipot, namamaga or inflamed, or even sometimes nagpuproduce po ng mucus or secretions because of the trigger factors brought about by the allergens or maybe dust that could lead to asthma exacerbation. So what are the symptoms of asthma? Actually, it varies from one person to another. It depends on actually the trigger factors. Ano ba yung trigger factors? Yun po yung reason kung bakit ka pwedeng atakihin ng asthma, like allergens in the form of pollens, strong odor, perfumes, dust, tobacco smoke, nicotine, and even mood swings, no? Sobrang happy, sobrang sad. This could actually trigger asthma. But what exactly are the manifestations? A person may experience shortness of breath, kapos sa paghinga, there could be difficulty of breathing during exertion, and also sometimes patient would have whistling sound or yung wheezing sound. And also for children, I noticed that they would have coughing, especially in the evening and early morning. So what are the risk factors for asthma? In layman, lagi nila sinasabi na huwag kang lumapit siya, nakakahawa kasi asthmatic siya. I just want to emphasize that asthma is not transmissible. Actually, it is more of the inheritable disease. How about those with no family history? They can also have the possibility of asthma. That is roughly 5 to 15%. So what are the trigger factors or the causes of asthma in this population? One would be previous respiratory infections. Could be viral, bacterial, but more often than not in children, more on virus po yung cause. Yung simplong ubo, sipon, can trigger asthma. Patients who were born premature because their lungs were not fully developed, the airways are smaller. Children who are exposed to tobacco smoke, pwedeng second-hand smoke exposure or pwede rin yung tinatawag na third-hand smoke exposures. Patients who have been working in hazardous areas. So most often than not, yung mga exposed sa dust, sa mga asbestos, and so on, could also trigger asthma even if they don't have asthma in the first place. I would just like to emphasize that just be able to empower yourself, no? I-educate natin yung sarili natin. Sa lahat ng sakit, lalo na kung tayo ay asthmatic, we should be familiar with our symptoms. Remember that knowledge is the key for us to save lives.
If you
you like this video, please follow our FB page and subscribe to our YouTube channel for more health videos.
And don't forget to hit the notification bell.